People with type 1 diabetes should not be eating like people with type 2 diabetes. Okay, so the truth is we all want to be eating healthfully, and we should approximate the same sort of diet, whether you're living with type 1 or type 2, but the difference is that we're starting at very different places. You probably see a lot of videos saying that you need to eat in a particular order if you're living with type 2 diabetes, which I don't have any issue with. In fact, it does make it a little bit easier for your insulin system to deal with the food that's coming in. And the reason for that is we want to slow down how quickly you're digesting and absorbing those carbohydrates in your food so that your insulin can actually deal with them. Whereas with someone who's living with type 1 diabetes, it gets a little more complex if you're eating the salad and the protein before you're eating the carbohydrate. See, if you're slowing down how quickly your body's digesting and absorbing carbohydrate, then your insulin isn't working in the same time frame that the carbohydrate is being absorbed. This can result in going high immediately after you've eaten something, or even going low right after you've eaten something. Typically, if you're eating with that pattern, but you've dosed your insulin, then what's gonna happen is your blood glucose is gonna go low. And once again, the reason for that is because the absorption of carbohydrate into your bloodstream and the insulin absorption into your bloodstream is mismatched. While I absolutely think there's a time and place for eating your foods in a particular order, you have to know what you're doing with your insulin. Oftentimes, people will pre-bolus for a meal, and then they'll eat their veggies first, they'll eat their proteins, and then they'll eat their carbohydrate, and before they know it, their glucose is going low. Whereas if you pre-bolus and then you just eat all the food all at once, the carbohydrates, the protein, and the vegetables, then you're probably going to be better off. I just wanted to clear this up because I get a lot of type 2 patients who are eating in a particular order and it works fantastic. And then I get a lot of type 1 patients who are trying to eat in a particular order and not understanding why their glucose is going high or low, and not having an understanding of where your blood glucose is going to end at the end of a meal. At the end of the day, we probably all want to eat healthfully so that we're managing our blood glucose, but this can look very different for people living with type 2 diabetes or prediabetes and type 1 diabetes. Anyways, if you like this kind of content, then make sure to like and save it and follow for more. Thanks for watching.